recording. And I might upload, or you may still have it, obviously, when we did the integument in anatomy, which is the skin, because the beginning of the chapter does review, but I wasn't going to do a whole anatomy review just about the skin. If you remember, you have the epidermis. Yes, Brooklyn, these are the notes for the homework, but you'll also find a lot of the answers in chapter 6 in your book, which is the canine feline skin section. But you have the epidermis, the dermis, the hypodermis, the structures within the dermis, and especially what will be important is like the we talk about seborrhea, or we talk about sebum, which is secreted from the follicles in the skin that protect. So we'll kind of get into seborrhea, but I'm going to kind of talk about really allergies first. And what we refer to allergies as atopy, or sometimes it's called atopic dermatitis. I spent about 8 months working in an animal dermatology practice. So kind of when we approach, what I want to say right off the bat, when we approach allergies, they can be divided into two. If we talk about atopy, and typically we're talking about inhalant allergies, but also I'm going to get into food allergies because they can cause very similar symptoms. So sometimes they're slightly different, but I'm going to start with kind of what we talk about as the inhaled allergies. And when they encounter an allergen, and that's something that's going to trigger the allergy, like pollen or dust. When they inhale this, they are actually going to absorb that. And these animals typically have a hypersensitivity. They have like a hyper reaction to encountering that allergen. Now, typically for us, if someone is allergic to grass or pollen, you get the watery, itchy eyes, runny nose, sneezing, maybe you get a little bit of a cough. In animals, occasionally owners will complain about runny eyes, like especially just watery eyes, but they don't get a lot of sneezing, maybe occasionally, but theirs tends to manifest in their skin and then presents as a reaction on their skin versus the, how we would get an allergy. And the biggest clinical sign of atopy is pruritus, which is itching. So what happens is the dog starts to itch. Okay. Now I'm going to jump off the notes here for a second and explain that. If a dog scratches their skin and then it gets red and then it gets inflamed, and sometimes then what happens is, every animal has resident bacteria on their skin. But anytime skin becomes red and inflamed, the problem is that bacteria can get into the pores or into the skin, and then they can get what's called like a secondary skin infection. So sometimes I'm jumping ahead because I'm going to talk about pyodermas, which is literally pus in the skin, but sometimes those like little red bumps or pustules or skin infections can be secondary to an allergy. So when they scratch the skin, then it can progress. Now, something that I want to add as a sign under here, you should put on your notes. This can also be chewing and licking at the paws. So there is a lot of scratching, but then again, they can't scratch their paws necessarily. So what do? They chew their paws. And a lot of dogs, especially if you have a dog that has white, or if they're like a yellow lab, sometimes the paws will look rusty. And what that rust color is actually saliva staining. So the more they lick their paws, occasionally I look at Bo and he's got white on his paws, and underneath you'll see the rust kind of color. And again, I'm like, oh, you've been licking your paws. So sometimes we're going to, the owner's going to catch them. Sometimes we're just going to look at the chewing on the paws and, scratching of the ear. And I will say, uh, I've had two dogs with allergies, and my old golden years ago would get terrible ear infections, like ear infection after ear infection. And when I took him to the dermatologist, this is when I was working at Purdue, the dermatologist was like, the skin of the dog is just rolled up to the tube, rolled up in a tube in the ear. So he goes, if you think about the ear canal, that is the dog's skin in a tube in their ear. So a lot of ear infections, and this made like, it was kind of like, oh wow, I never thought of it that way. A lot of ear infections can be rooted in a skin allergy. So some dogs, I'm just saying broadly, some dogs are going to be scratching their trunk and their legs. Some are going to be chewing their paws, and some are just going to get these awful ears and they just scratch their ears. So allergies can present in a lot of different ways or manifestations, but the big thing is itching, itching, itching. So let's think about the same things that typically cause what are inhaled allergies. Well, we've got pollen from the grass and the trees, weeds. There was this one lab that used to come to dermatology, and grass and weeds grass and tree pollen were that dog's allergies. So of course, when the trees were getting their leaves and the grass was first coming in the spring, this dog was a wreck. Once the trees came in and everything grew, he was fine the rest of the year. It was like that was his season. Because I'm going to talk about allergy testing. So the problem is you may just notice, oh my gosh, March and April, my dog is a mess, and then he's fine. Well, your dog has what we call a seasonal allergy, meaning it always happens when trees emerge and grass grows. Now, what are other things that they can be allergic to? Dust mites, cockroaches, mold. The problem with my golden was allergic to house dust, mold, cat dander. Well, I had cats. Are they ever going away? No. Mold, if you have house plants, those little white dots that grow on the top of the dirt, or it looks like white, that's actually a form of mold. And, not that you have to have a moldy house, but house dust is not seasonal. That's there all the time. I mean, my house is dusty. Do I dust all the time? I mean, you can't get rid of dust. It's like impossible. Mold, if you have plants, I mean, those things are non-seasonal. So when we talk about allergies, if it's called environmental allergies, that means they're allergic to something in their environment, but it can be seasonal or non-seasonal. Grasses and tree pollen, ragweed and pigweed. I mean, I don't know if anybody's allergic in the fall when you got all the weeds and the things are blowing in the wind. That's a fall type kind of allergy that's seen more in the fall. So there's a seasonal allergy component, and then there can be non-seasonal. And when they react, so when they inhale the allergen, let's talk about what happens. The allergen runs into what's called IgE. And I don't know if you guys have talked about your immunoglobulins. You will talk about these in, ClinLab 4. And maybe you talked about them a little bit in Animal Tech 2. But there's different immunoglobulins. IgE is typically an immunoglobulin on the surface of a mast cell. So in your body, you have mast cells. Mast cells contain histamine granules. So they're little secretory granules in a mast cell. And when the allergen binds to the IgE, it releases those histamine granules. Now, when a histamine is released in the body, this is called mast cell degranulation. It's basically when they degranulate, they're releasing their granules. That's what that means. Now, what happens is these histamine granules signal neutrophils, eosinophils, and macrophages. They signal those inflammatory cells to come to the area. And what happens is these are important inflammatory mediators. So what they're doing is they're trying to go to the area and they're trying to fight the allergen. They're trying to fight that invader. But when it does that, it creates redness, inflammation, because all those cells are kind of rushing to that area, all that histamine. That's why if you have an animal that has allergies or you have allergies, sometimes you take an antihistamine, because what you're doing is you're trying to prevent your body from releasing histamine, because when it gets released, it causes all these symptoms. So that's what's happening. Now, I want to make a note and make sure that you put in your notes somewhere about eosinophils. Eosinophils, again, you guys are in Clin Lab 2 currently. So you're learning, you should be learning right now the different types of white blood cells. So I don't know if you've talked about, have you guys talked about eosinophils yet? Okay, when I hear eosinophils, I think allergy. Eosinophils, when you do a CBC, when you do a hemogram, and you look at the types of white blood cells, the levels in a patient, when I see that eosinophils are elevated, when that number is elevated, I think two things. The animal either has a parasitic infection, or maybe they have an allergy. It can be or it can be from an immune response, like an autoimmune response, or it can be a response to an allergen. So the eosinophil is associated with this allergy inflammation. Because when an animal has inflammation from like a bacterial infection, I'm like ding 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 neutrophils. When they have lymphocytes elevated, I'm like ding 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 virus. When eosinophils are elevated, I'm like allergy, parasite, something of those two. So the white blood cells kind of are triggered by different things, and think eosinophils and allergies. So the other thing that we have to think about when there's skin infections is environmental things can make it worse. Obviously, in the warmer climates, and the warmer they are, it can make the skin more inflamed. Humidity and level of hormones does affect these skin infections. One thing, because I get a lot of students that ask me about their pets, and I don't mind that at all. If you have a dog with allergies, though, I will tell you, we always said if you were going to give them a bath, we do warm to cool water baths, because you don't want to add hot water. Hot water can cause vessel dilation and can make the inflammation a little bit worse. Not that anybody wants to take a cold bath. I'm not saying bathe your dog in super cold water, but you just don't want it to be too warm, because again, that could, because a lot of these dogs need baths to help treat some of these conditions. And anytime I have a dog with a skin condition, I make the water a little bit cooler, because again, hot water can kind of inflame certain conditions, especially atopy. Now, history, any dog can get allergies, but there are some key offenders, Dalmatians, Labradors, and if I would say some of the worst ones, yes, and cold water, that's a good point you bring up, Catherine, because cold water will shrink the vessels, which decreases the blood flow to that area, should help the inflammation. So yes, the cool water is definitely, can be soothing. Of the Labrador retrievers, I feel like in the 8 months that I worked in dermatology, I feel like I saw chocolate labs more than the other labs. I mean, we had yellow labs and we had black labs, but for some reason the chocolate, and I kind of call chocolate labs are kind of like redheads of the dog world. Sometimes more sensitive skin, Sometimes when dogs, what I've noticed too is dogs, if they've got like a pinkish type nose versus that black nose, It's sometimes that they have a fairer complexion. Sometimes they're more sensitive to being outside. And um, terriers, Shar-Peis, golden retrievers, Shar-Peis. But one dog that I would is pit bulls, Staffordshire Terriers. We saw a lot of pitties in our derm practice with allergies. So they would be another one that I was like, just in the 8 months I was there, I felt one week I'm like, is every appointment this week a pitty? I feel like we're seeing them all the time. So there can be um, a breed predisposition to allergies. And the age wise, it can be when they're young. And usually, if they're going to emerge with an allergy, um, yes, it's just super common. But usually, they're going to be like the 1 to 3, they're young. I want to say my dog that I had just before these two, he had food allergies, but his food allergy emerged. He was like 18 months. So he wasn't quite 2 years old when we diagnosed him with his food allergy. So it was kind of in that young age. Although older dogs can develop it. And usually younger dogs, you might see signs if they're like that 6 months to a year, but normally it may not be definitive until they grow up a little bit. So 1 to 3. But if they're older, it's not as common, but you also have to think about it. What if they moved? Like if we have someone that lived in Florida and their dog was fine, and then they moved to Indiana, their dog's 7 or 8 years old, and then all of a sudden, because of the trees that we have in that region, it might be different than, palm trees in Florida. So sometimes if a dog develops older seasonal or like environmental allergies, it was maybe associated with a move to a different region, a different grass population, a different tree, weeds, things like that. So symptoms, again, I mentioned here, we're on page 2, symptoms can be seasonal or non-seasonal. If I was going to have a environmental allergy dog, I would hope mine is seasonal, because then that means they have some relief. Like I said, this lady who loved this lab, he was god awful in the spring, but the rest of the year she was like, I just got to get him through this phase and this when the trees are blooming, and once everything's bloomed, he was pretty much good for then the winter. The problem is, again, if it's non-seasonal, it's house dust, it's fleas, it's cat dander, it's mold. Those are feathers. I mean, those are things that don't go away with seasons. So that's how you determine seasonal allergy, non-seasonal allergy. And it says, there's a note here about dogs that are sensitive to allergens inside will have non-seasonal allergy disease. Again, meaning they will sometimes show symptoms for the majority of the year. Now, like I said, there's things that you can try to adjust in the house, getting a HEPA filter, dusting more, getting rid of the plants and checking for mold. But the problem is, it's so hard for things like that, like dust mites. I mean, it would almost be impossible to rid your house of things like that. So you can do your best practices, change your filters, dust more, clean, and to do the best you can. But the problem is, again, non-seasonal is, there. And the majority of dogs that are seasonal, they have year-round symptoms, but the worst, even if they're year-round, usually they're worse in the spring, summer, fall. Winter, because everything gets cold, it tends to minimize things like the mites and mold. Obviously mold is in a warmer, moist environment. Dust mites, things like that. You think about things that survive in certain environments. And that's why winter, sometimes you'll see those 3 bad seasons and then they get a good season. So And then you have the poor dogs that are literally allergic the whole year, no change, awful allergies. Cats don't have as many environmental allergies as dogs. They tend to develop around the same, 1 year of age. Um, and they can start to get skin lesions. So they may start to get a redness. They lose hair over the tail. You might see them chew their paw, scratch their ears. So it's similar symptoms. It just tends to be a little more rare in cats than in dogs. So again, the big clinical sign um, that we look for, and we are going to talk, since Catherine, since you mentioned that, we're going to talk about flea allergy dermatitis, which is part of atopy, which is, because fleas, but we're going to be a little more specific, because yeah, you'll have animals that are going to react to that. So we do talk about that. So some of the one thing is they can be itchy everywhere, but usually allergies have certain space or certain places. The face tends to be the muzzle area, the chin, and also the skin around the eyes. My poor dog, when he had his food allergies, he chewed his paws raw, like they was like almost no fur. He had a ring of fur that was missing because he would rub his eyes. And he would claw, he had sores on his face because he just scratched. I mean, when I would hear him dig at his face, it was just incredible. But again, some dogs, it may just be the pinna. The pinna gets inflamed and they scratch their ears. And we tend to see the symptoms more in the outer canal, and the pinna is the flap on the outside. So sometimes it'll get in the canal, sometimes it'll just be the flap. And then their groin or abdomen, and then again, chewing the feet. And so these are kind of like locations that tend to drive them nuts with these allergies. And again, it can be just licking of the paws. Like there's some dogs that they're just going to lick their paws and the rest of their body looks fine and their ears look fine. So they can have a couple of these locations, all of these locations. They're all a little bit different. If they have the generalized pruritus, they're just itchy everywhere. Face, body, feet, ears, they're just kind of scratching crazy. Like they just can't relieve their itch. Let me scratch where his eyes. Oh, yeah. I mean, and some of these guys, yeah, they will hurt themselves. Like Colin just wrote in there. I mean, they're just, sometimes they're going to be so going at an area that they can actually cause damage. And I'm going to talk about Apoquel, some treatments that there have. And there's been a lot, they've made a lot of advances in allergy treatment. So they are definitely better. And they can escalate. So it can start off by minimal itching, and then they tend to get worse as they get a little bit older, the allergy. So sometimes you don't see, and this is important, it says in most cases there's no specific skin lesions. Again, it's not like they're missing one patch here and it's super itchy in one spot. That's a little bit different. This is diffuse. So there's like itching and they can kind of look overall red, or like Cassidy said, or someone put their belly got itchy. So sometimes their belly is really red sometimes, but it's not like it's a spot. It tends to be diffuse over the body. Now, anytime that they have pruritus and they lick and bite and scratch, the problem with allergies is they cause this secondary skin infection. And when they traumatize the skin by scratching, then you get the bacterial skin infections. And again, that's just resident bacteria that take advantage of this disruption of the dermis or the epidermis from itching. It makes it more porous. Bacteria go in, and then you get these secondary bacterial infections. And what can happen with chronic pruritus, if you've got an animal that's just itching like crazy all the time, then you're going to get things like alopecia, where they can actually scratch so much that they scratch the fur, and so alopecia, they're going to be missing their fur. Lichenification. So let me talk about lichenification. That's actually where the skin, where the fur was initially missing, it becomes thickened, and it becomes almost crusty, but not like a scab crusty. It actually changes like the consistency of the skin in that spot. Sometimes it happens to the pinna. The pinna begins to look really thick. It almost looks like it's turning, I'm not going to say to stone. That's a weird way to say that, but it has a very odd appearance when it becomes like that. And I'll try to post some pictures of this, which there are some pictures in your book, but I'll try to find some pictures of this. And they can also get hyperpigmentation, because what happens if they keep scratching in the same area and scar tissue forms because of like chronic irritation, chronic inflammation, it can actually start to change pigment in certain areas, especially like on the abdomen or maybe on the pinna. You start to see a change. And let me mention something about the ears. There's not a lot of notes about otitis externa in the book. I'm going to probably try to add some notes, some separate notes about ear infections. But otitis externa is very common. About 50% of dogs present otitis externa, is just like an ear infection, which affects more of the pinna and the outer canal. So we're not talking about deep ear infection. It could progress to an inner ear infection, but a lot of times atopy, it's like the outer ear and then kind of like the pinna and the part of the canal you can see. But the problem is when you get chronic erythema, which is like that redness of the skin and the itching, you get a lot of secondary infections of that, and then those secondary infections can travel to the middle ear. And what we really, really, really worry about is when you have an animal that has chronic ear infections, meaning they just, like my old golden, she just had ear infection after ear infection after ear infection. Her ear was starting to get, it was thicker because it's constantly healing and scarring. And then she gets another infection, and then it heals and it scars, and then it's inflamed. Well, all that inflammation and scarring, it's eventually going to, it can potentially calcify the canal. I'm going to tell you, why did I not write Cocker Spaniel on this list? We had a surgery that we used to do at Purdue called a TICA. And a TICA is what's called a total ear canal ablation. We had this cocker, one of the worst cases I saw. The cocker came in with these cauliflower ears because the chronic ear infections, and of course, cockers have mud flaps for ears, long, heavy ears, traps moisture, inflammation. Well, the problem was it developed scar tissue, and then what happened is the tissue overgrew in the canal and it became calcified. The dog was deaf in both ears. And what problem is that after scarred down, we had to surgically go in and remove the ear canals. And then if you lift up the ear flap, you look at it and it's like sewed shut. But we actually the doctor cuts from here up, and they actually cut out you don't remove the pinna, you just cut out the canal and all of the calcified tissue. Yes, they're very bloody. This dog's surgery was 8 hours. It was one of the longest. We took out both canals, and the doctor decided to do it in one surgery. It was literally an 8-hour surgery. Of course, we're a teaching hospital, and he was teaching, so it went longer than normal. But this dog's ears were so scarred and so bad. But we took out, I mean, the dog was deaf in both ears anyway, so we took away the source of pain. Because those dogs, you could barely touch this dog's ears and he would just scream. So we were, so again, I'm going to stop there, and I'll try to find some of this lichenification and some pictures and maybe get some of these pictures into just like a picture PowerPoint or send them to you. So, are there any questions as far as um, this lecture or the notes or what you need to do?